Come a little closer. This machine here, a lot of gyms have them. Some gyms, the machine itself isn't very good, mainly because of the positioning on your thighs. This one is actually really good because when I step into it, the machine itself is putting its pressure on the midline of my thigh. Now, a lot of different gyms will have them set up so it's putting pressure on your knee. I don't want you to have that knee pressure and that displacement on your kneecap because it's actually pretty bad for your leg. Now, this one's actually really great because it's on the midpoint of my thigh. So what I'm going to do, it's called a hip adduction or hip abduction. Okay? Don't worry about the terminology, but that's just basically what they're called. So if I ever assign you something in your program called hip abduction, abduction is away from your body. Whereas when you're coming together, and there's a lock on the side of this, and most gyms, if not all, will have a lock on these, unless they're specifically designed for different use. But there's a lock that I can open this up with, and it now becomes hip adduction, bringing my legs together. Okay? Same sort of movement, and you're just going to bring your legs together, squeezing, and bringing them back out. Now you should feel pressure on the inside of your legs here, okay? Just in and around your groin area, and the opposite when you're doing hip abduction. So bringing it back in, and what you're going to do is extend out. You should feel the pressure on the outside of your legs. Okay, coming back all the way down so the weights are rested, and then extending all the way as far as you can back out. Now, just as important as every other exercise, keep your neck against the pad, keep your back nice and straight, and just extending out, just like this. Really basic, and in the opposite sense, grab the lock, unlock, keeping your back nice and straight, neck against the pad, extending out. Really basic. Okay? When you're ready to get out, if you're stuck in this position here, grab the lock, it'll unlock for you, and then grab a handle, mount out of the machine, and that is your basic hip adduction and hip abduction.